Welcome to Module 1, Lesson 6. In the previous lesson, you learned the specific role and responsibilities of the medical interpreter and why staying within that role protects patients, providers, and interpreters alike. Now that you understand what the interpreter's role is, we're going to explore one of the most challenging areas of professional practice, the difference between scope of practice and advocacy. This lesson will help you recognize where the line is and how to stay on the right side of it, even under emotional pressure. You have to pay full attention, so let's dive in. We have to ask ourselves, why does this topic matter to me? Many interpreters struggle with this topic not because they lack professionalism, but because healthcare settings involve fear, pain, vulnerability, and power imbalances. In these moments, the desire to help can blur boundaries. Ethical standards and professional codes exist to guide you through exactly these situations. If you want to understand why boundaries matter, we first need to clearly define what scope of practice means. What is scope of practice? Scope of practice refers to the defined boundaries of what a medical interpreter is professionally authorized to do. These boundaries are established by ethical codes, professional standards, training programs, and certification bodies. Within this scope, interpreters are responsible for 1. Accurately interpreting everything that is said. 2. Maintaining completeness, neutrality, and confidentiality. 3. Preserving tone, intent, and register. 4. Requesting clarification when meaning is unclear. 5. Managing communication flow to support accuracy. You have to understand that scope of practice does not change based on emotion, urgency, or personal comfort. It applies equally in routine visits and high-stakes situations. Does this sound like a restriction to you? Many people have strong opinions about that. So why do these limits exist in the first place? Scope of practice exists to protect everyone involved. It protects patients by ensuring unbiased information, providers by preserving reliable communication, interpreters by clearly defining responsibility. When interpreters stay within scope, responsibility for decisions remains where it belongs, with the patient and the provider. When interpreters step outside scope, even with good intentions, responsibility becomes blurred and trust can break down. This brings us to the concept that is most often misunderstood: advocacy. Let's talk about what advocacy is and why it is misunderstood by many. In everyday language, advocacy means speaking up for someone, defending their interests, or influencing outcomes. In many professions, advocacy is expected, but medical interpreting is different, just like the way a lawyer is different from a doctor. As a medical interpreter, you do not advocate in the general sense. You do not argue for treatments, persuade providers, or guide patients toward decisions. Doing so would compromise neutrality and interfere with informed consent. However, the good news is, there is one form of advocacy that is permitted. Aren't you excited? Let's take a look at it. Now that we understand what advocacy is, we need to examine which aspects of advocacy are permitted and which are not. Let's begin by looking at permitted advocacy, which is the language access advocacy. Interpreters do advocate, but only for language access, not outcomes. Language access advocacy includes requesting clarification, asking speakers to slow down or repeat, noting linguistic confusion, ensuring everything is interpreted. This type of advocacy protects communication. It does not influence decisions. To see the difference clearly, let's look at what falls outside permitted scope. What is outside the permitted scope refers to forms of advocacy that are not allowed. One example of non-permitted advocacy is decision advocacy. Decision advocacy happens when an interpreter begins influencing choices. Decision advocacy includes encouraging a specific option, expressing agreement or disagreement, explaining medical content independently, softening or strengthening messages. Even when the intention is to help, these actions alter the communication process. So for example, saying things like, "I think the doctor means it's not serious," or "If I were you, I would," crosses professional boundaries. So why is helping in this way actually harmful? Why helping can be harmful. Many interpreters enter this field because they want to help others. That motivation is valuable, but it must be carefully managed. As an interpreter, you are a language and cultural expert, not a medical or legal expert. When asked to help outside your role, the professional response is to politely refuse and offer to interpret instead. Helping by interpreting accurately supports patient autonomy. Helping by influencing decisions removes that autonomy. This becomes especially difficult in emotionally charged situations. Let's talk briefly about emotional pressure in this situation. Healthcare encounters often involve fear, pain, and power imbalances. Patients may turn to interpreters because they feel safer or more familiar. When this happens, professional discipline requires you to interpret, not advise. Let's look at a scenario where boundaries are tested in real time. In this scenario, the doctor explains a treatment option with serious risks. The patient turns to interpreter and asks, "What would you do if you were me?" As a professional interpreter, you do not answer. You interpret the question exactly as stated to the doctor. Why does this matter? Because if the interpreter answered, he would be inserting his opinion and influencing a medical decision. By interpreting instead, you preserve patient autonomy and professional boundaries. Lesson 6 completed. In this lesson, you learn the difference between scope of practice and advocacy. Medical interpreters do not advocate for decisions or outcomes. Their advocacy is limited to ensuring language access and accurate communication. Accuracy is your responsibility. Decisions are not. With this foundation in place, the next lesson will focus on applied practice. You'll examine real-world situations where staying in role is tested, and you'll practice responding in ways that keep you professional, neutral, and accurate under pressure.